Hello and welcome. Thank you very much for joining us. We appreciate you taking the time to join us today for this urinalysis presentation. We hope you'll enjoy the topic entitled, When You See Casts and Crystals, You're in Trouble. My name is Dawn Tobin. I'm the manager of the Technical Product Specialist team at Beckman Coulter, and I will be one of your speakers today. Joining me on the call is Dr. Stephen Ness. Dr. Ness is the Director of Medical and Scientific Affairs for Beckman Coulter. Without further ado, I'd like to introduce to you Dr. Stephen Ness.
Thank you, Dawn, and welcome everyone. During this first part of the webinar, I'll start with a broad overview of the renal system, then highlight the health impact of kidney disease. Next, I'll focus on the presence of casts and crystals in a urinalysis, and finish with the clinical utility of identifying casts and crystals in a urinalysis. The renal system. Let's begin with an overview of the renal system. The renal system consists of the kidneys, ureters, bladder, and urethra. We will focus on the paired bean-shaped organ called the kidneys. The kidneys serve several vital functions. First, they are the primary filter of blood, thus eliminating waste from the body and forming urine. They produce the hormone erythropoietin, which stimulates production of red blood cells, and produce the hormone calcitriol required for calcium regulation. The kidneys also play a key role in regulating blood pressure and maintain the body's correct balance of electrolytes such as sodium and potassium. The nephron is the microscopic structural and functional unit of the kidney, where on average, each kidney has over 1 million nephrons. Each of the 1 million nephrons is composed of the glomerulus and tubule. The glomerulus is a tuft of capillaries surrounded by the Bowman's capsule. It is the Bowman's capsule which is the beginning of the tubular component of the nephron that performs the first step in the filtration of blood to form urine. The tubule is depicted in yellow in the picture to the right, where the arrows indicate the flow of fluids from the Bowman's capsule through the loop of Henle and to the collecting duct, where the formed urine then enters the bladder by way of the ureters. Chronic kidney disease is damage to your kidneys, which prevents them from functioning properly. The disease is labeled chronic because the damage happens slowly over a long period of time, getting progressively worse. Currently, 1 in 7 adults are in varying stages of chronic kidney disease. The problem is that early disease is usually without symptoms, and the person does not even know their kidneys are damaged. Fortunately, a simple and easy urinalysis test can detect most cases of kidney disease early. And just like most medical conditions, early diagnosis and medical intervention leads to better patient outcomes. So what is the health and economic impact of this silent killer? Chronic kidney disease affects 8 to 16% of the population. $60 billion is spent on chronic kidney disease in the U.S. alone each year. And the incidence of chronic kidney disease is increasing 5 to 10% every year. Another way to appreciate the severity of kidney disease is to understand that it is the 9th leading cause of death in the U.S. Approximately 90% of those affected do not even know that they have kidney disease. I want to emphasize that 90% of those affected do not even know they are in some stage of kidney disease. The 2 main causes of chronic kidney disease are diabetes and hypertension. Coincidentally and unfortunately, hypertension is also known as the silent killer, as many with hypertension also are not aware that they have high blood pressure. So you have a situation where the silent killer hypertension can cause a person to develop the silent killer chronic kidney disease. In 2017, over 746,000 Americans were in kidney failure, with 500,000 of these patients requiring dialysis at least 3 times each week. Additionally, over 23,000 Americans received a kidney transplant in 2019, while another 100,000 are on the transplant wait list. March is Kidney Awareness Month, represented by the green ribbon. Chronic kidney disease is not just a disease of the elderly. It affects patients of all ages. Caroline, for example, was 29 when she was seen by her physician for frequent headaches. Testing showed her kidneys were only functioning at 29%. She was diagnosed with IgA nephropathy, also known as Berger's disease, and required a kidney transplant. Her first transplant failed, and fortunately, her second transplant was successful. To learn more about Caroline's story and others impacted by chronic kidney disease, please visit kidneysforlife.org. A quick, simple, and easy urinalysis test highlights the importance of the laboratory's role in patient care. At least 70% of all physician clinical decisions are made from a laboratory result. This is especially important with chronic kidney disease, as many patients have no idea that their kidneys are failing. Again, the earlier chronic kidney disease is diagnosed, the better the outcome for the patient. It is the presence of casts and/or crystals on urinalysis that may be one of the first early indicators of underlying kidney disease. The secret behind casts and crystals. Urinary casts are simply cellular debris and particles that get stuck in the renal tubules and subsequently excreted in the urine and detected by urinalysis. Specifically, this debris is a mucoprotein that takes the shape of the lumen, or inside, of the tubular duct. The picture depicts the functional unit of the kidney known as the nephron, which is the glomerulus and tubule, with the tubule appearing yellow in this picture. A few of the different types of casts appear on the far right, with the dashed lines showing approximately where each type of cast is formed in the tubule, with some formed closer to the loop of Henle and others forming further along in the tubule in or near the collecting duct. Granular casts. Granular casts vary from coarsely to finely granular particles and clinically indicate acute tubular necrosis or advanced renal disease. A small number of these casts may be present in the absence of disease or found after intensive physical activities. Red blood cell casts. Red blood cell casts are frequently pathologic and clinically a red flag. Red blood cell casts indicate bleeding from the nephron and suggestive of glomerular dysfunction. White blood cell casts are primarily composed of neutrophils. White blood cell casts are clinically significant for infection or inflammation within the nephron or infection within the kidney, to include such conditions as urinary tract infection, pyelonephritis, and cystitis. Waxy casts suggest tubule damage. They are composed of various cell types. These are the largest type of casts, and they are clinically significant for advanced kidney disease. Fatty casts are made of just that, fat or lipid-laden cells. They are formed by the breakdown of lipid-rich epithelial cells. They appear as a distinctive T's cross pattern under polarized light and are clinically significant for nephrotic syndrome, diabetes, and hypothyroidism. Epithelial casts are usually the result of the breakdown of cellular casts and formed by the adherence of epithelial cells to the tubule lining. These casts are clinically significant for a broad range of conditions to include acute tubular necrosis, nephrotic syndrome, and heavy metal ingestion. The most common type of casts is hyaline casts, which are composed of mucoproteins. These casts may be a normal finding after strenuous activity or diuretic use, and clinically may indicate pyelonephritis or chronic kidney disease. Urinary crystals. Aside from casts, crystals may also be detected on urinalysis. These crystals are formed by precipitation of urine salts. Crystals may be a normal finding, but are also indicative of underlying issues, primarily kidney stones. Kidney stones. Kidney stones are also called renal calculi, nephrolithiasis, or urolithiasis. They are hard deposits made of minerals and salts that form inside your kidneys. A kidney stone usually will not cause symptoms until it moves around within your kidney or passes into your ureters. The ureters are the tubes connecting the kidneys and the bladder. If it becomes lodged in the ureters, it may block the flow of urine and cause the kidney to swell and the ureter to spasm, which can be very painful. The most common symptom is severe pain, usually in the side of the abdomen. And yes, the kidney stones pictured on the left are actual pictures and sizes of real kidney stones. Look closely and imagine how those sharp edges feel as they make their way from your kidney through your ureter and into your bladder. Treatment includes pain relievers and drinking lots of water to help pass the stone. Medical procedures may be needed to remove or break up larger stones. Risk factors for kidney stones include family or personal history. If someone in your family has had kidney stones, you are more likely to develop stones too. If you've already had one or more kidney stones, you're at increased risk of developing another. Dehydration. Not drinking enough water each day can increase your risk of kidney stone. Certain diets. Eating a diet that's high in protein, sodium, and sugar may increase your risk of some types of kidney stones. And another risk factor is obesity. There are several different types of crystals that can be detected on urinalysis. Calcium oxalate, often an indication of antifreeze poisoning or chronic kidney disease. However, calcium oxalate crystal's biggest claim to fame is that this crystal is the most common cause of kidney stones. Other crystals include uric acid, calcium carbonate, ammonium biurate, and triple phosphate, with triple phosphate often associated with urinary tract infection. Side note about antifreeze poisoning. Ethylene glycol is a colorless, odorless, sweet liquid commonly found in antifreeze. When broken down by the body, it results in glycolic acid and oxalic acid, which cause most of the toxicity. The diagnosis may be suspected when calcium oxalate crystals are seen in the urine. Diagnosis is confirmed by measuring ethylene glycol levels in the blood. However, many hospitals do not have the ability to perform this test. In the absence of ethylene glycol testing, hospitals may use a Woods lamp where the urine containing ethylene glycol fluoresces on examination. Additional types of crystals that can be detected on urinalysis include cysteine, hippuric acid, bilirubin, cholesterol, leucine, and tyrosine. Cysteine crystals are caused by a rare disorder called cystinuria. The disorder causes a natural substance called cysteine to leak into your urine. When there is too much cysteine in the urine, kidney stones can form. These stones can get stuck in the kidneys, bladder, or anywhere in the urinary tract. Most people with cystinuria have recurring stones. Cystinuria is an inherited disorder. It is a lifelong condition that can be controlled but not cured. Leucine and tyrosine, crystals of the amino acids leucine and tyrosine, are very rarely seen in a urinary sediment. These crystals can be observed in some hereditary diseases like tyrosinosis and maple syrup disease. As you can see, chronic kidney disease is a serious medical condition that is only increasing in the number of those affected. The laboratory and physician partnership is an important component in both the diagnosis and treatment of this disease. And again, the earlier chronic kidney disease is recognized, the better the outcome for the patient. Dawn will now highlight the key features of the urinalysis. Dawn?
Thank you, Dr. Ness. That was great information. And as we know, your lab has very important testing to perform. This is why we want to help you take the subjectivity out of the urinalysis test. Our iris analyzer has been on the market for over 30 years, and we are still the market leader in automated urinalysis. Beckman Coulter continues to invest in the most innovative technologies to help assist your facility with accurate testing and diagnosing of your patients. We have the most extensive classification capabilities on the market today. We also have the ability to customize the appropriate analyzer and analyzer reports specific to your laboratory's needs. Additionally, our software with auto-release capabilities allows your staff to focus their time on your most critical patients. The IQ200 microscopy system, the database contains over 26,000 reference particles. As each sample is run through the flow cell, the system will capture 500 microscopic images. As shown here on the left, there is an image showing 5 particles in that picture that was taken. The system takes that image and automatically isolates, frames, identifies, and characterizes each of those urine particles present into one of 12 primary classification categories. The system then further allows the technologist to continue and subclassify them into one of 27 additional subcategories. An example of this could be subclassifying crystals into a specific type, such as calcium oxalate or triple phosphate, versus simply reporting unclassified crystals present. The system does this with an over 90% confidence interval, so you can be confident that you are getting and giving accurate results. Autoparticle recognition can be compared to a facial recognition software in that it identifies multiple specific characteristics of a particle to classify it into the appropriate category. The iris analyzes the size, shape, contrast, and texture of the particle before it categorizes it. What makes the system so different compared to other microscopy analyzers is that most of the time they are only looking at one feature of a particle. Now imagine if you were trying to tag someone's face using a software that only looked at one feature such as size. How valuable do you think that information would be? Classifying particles utilizing 4 separate specific characteristics allows the iris to accurately categorize the particles in your patient samples. The iris system has the capability of reporting your patient results qualitatively or quantitatively, depending on your facility's preferences. It can also store up to 10,000 patient records on board, storing the digital images of each patient specimen so that you can provide additional teaching and training to your staff or use them for further investigation later. We have scalable and customizable analyzer configurations to suit the needs of your laboratory. Our chemistry instrument measures 10 different analytes and utilizes the gold standard of reflectance refractometry to measure specific gravity. The IQ200 automated microscopy system classifies particles into 12 clinically primary categories with the capability of further subclassification into 27 additional categories. And finally, the IRIS is the only system on the market that is FDA cleared to run 8 different types of body fluids. So in summary, let's briefly review what we've covered today. Approximately 37 million people in the United States have kidney disease, with approximately 90% of them unaware that they have this disease. Urinalysis is a non-invasive and fast test to assist you in detecting kidney disease early. Urinary casts are particles that accumulate in the renal tubule and are associated with kidney disease. Urinary crystals are formed by the precipitation of urine salts and can be indicators of underlying clinical pathology. Now we'd like to go into a few frequently asked questions. So Dr. Ness, question number 1. At what point would a provider look into why hyaline casts are present?
Thank you, Don. A provider is going to look into any type of cast, including hyaline. It's important to note casts are not diagnostic, but simply a red flag to a physician that increases the physician's index of suspicion of underlying pathology. So the presence of casts prompts the physician to order further tests and initiate a medical workup in order to definitively identify the underlying cause of the presence of the cast.
All right, question number 2. What other results in a routine urinalysis, besides the casts that we've talked about today, help with identifying early chronic kidney disease?
Well, the main one is casts, but protein found in a urinalysis is also a red flag for kidney disease. It's the presence of protein in the urine usually indicates that kidneys are leaky and unable to retain protein. So the presence of protein in a urinalysis is reason for a physician to suspect kidney disease, and that will prompt him or her to order additional tests or a further workup.
Question number 3. Are there any other urine findings associated with nephrotic syndrome?
So for starters, nephrotic syndrome is a collection of symptoms due to kidney damage. So aside from the presence of certain casts, the major finding on a urinalysis will be the presence of protein, indicating the kidney's inability to retain protein. So again, the most common finding for nephrotic syndrome will be the presence of protein on a routine urinalysis.
Excellent. The last question we have today, so Dr. Ness, in my years in the laboratory, the crystal I probably saw most often was calcium oxalate. And I know those patients didn't have ethylene glycol poisoning. So what dietary changes could possibly be associated with urinary crystals such as calcium oxalate?
Yes. Well, first and foremost, decreased water intake is a major reason for the formation of crystals that cause kidney stone. So this is yet another reason to encourage all of us to maintain adequate water intake each day. Now, back specifically to the type of crystal that you were mentioning, A popular diet is the keto diet, for example, which is a high-fat, low-sugar weight loss strategy that forces the body into its natural starvation mode, causing it to rely on fat for fuel instead of on sugars and carbohydrates. The problem is the keto diet entails the consumption of more meat and fish, something that can increase calcium oxalate and uric acid levels, potentially leading to increased risk of calcium oxalate and uric acid crystals, which are common causes of kidney stones. So, four very good questions.
Thank you. Well, I hope you all enjoyed Dr. Ness's presentation as much as I did today. If you have any further questions or would like more information, please check out our related resources at beckmancoulter.com. And I would like to say a big thank you, Dr. Ness, for the great information today. And we hope that this concludes today's presentation, and we hope that you enjoyed it. And we certainly appreciate you taking the time today to be with us. So have a wonderful rest of your day. Thank you very much.